Good afternoon, everyone. Welcome to the National Health Insurance Authority's Beneficiary Educational Session for the month of March. My name is Chandra Sawyer, and I'm the Healthcare Wellness Specialist here at the National Health Insurance Authority. And I would like to take this time to welcome you all and thank you for taking your time out of your schedule and joining us as we host this session where we take time to educate our beneficiaries and the Bahamian public at large. Our topic for this afternoon is a beneficiary's guide to selecting a provider. And before I introduce our guest speaker in the person of Ms. Tanisha Pinder, our Benefits and Enrollment Supervisor, I just want to provide some information as it relates to the National Health Insurance Bahamas program, who we are, and our focus and where we are now in the program. Who are we? Our vision statement here at the National Health Insurance Authority is to lead the way in providing access to affordable, quality healthcare that Bahamians deserve. Our mission statement, we are transforming the healthcare system upon which the future well-being of Bahamians depend by putting patients at the center of every decision that we make. What are our core values? We are passionate about bringing universal healthcare to all Bahamians. We are relentless in expanding access to quality healthcare through progressive solutions supported by technology. And we are dedicated to delivering affordable healthcare through partnership. We are committed to doing business with integrity, accountability, transparency, and sincerity. And we honor our beneficiaries by providing care and respect in all aspects of our service. A part of our focus here at the National Health Insurance Bahamas program, it is wellness-based, it is wellness-specific, and we are dedicated to creating a platform where our beneficiaries and the public at large are encouraged and educated on adopting healthy lifestyles. And we want to encourage everyone to adopt these healthy lifestyles by incorporating regular exercise into their daily routine, by focusing on healthy eating, where we recognize and understand that food is as medicine, to focus on our mental, emotional, physical, spiritual, and our psychological health. And this goal is to ensure that Bahamians understand that the importance of living a well-balanced life ultimately leads to enhancing the overall health and well-being of our nation. Where are we now in the NHI Bahamas program? Since our inception in 2017, we can proudly boast that we currently have over 149,000 plus Bahamian residents who have enrolled in our program. Our demographic is very diverse, and our beneficiaries are currently enrolled from more than 17 islands. And we can brag that 6,700 plus Bahamians are under the age of 5, and we have enrolled more than 28,000 school-age children. And these numbers make up our pediatric population. And then we have enrolled over 18,000 plus Bahamians over the age of 65. And we call this category our precious pearls. 96% of our beneficiaries who are enrolled in the NHI Bahamas program have told us that they are satisfied with the success and the services that they have received as a result of their enrollment. Our provider network is very expansive. And today, there are a total of 143 physicians, which represent over 79 primary care provider facilities. And these facilities can be found on 7 islands, inclusive of New Providence, Grand Bahama, Eleuthera, Exuma, Cat Island, Abaco, and Bimini. And we've also partnered with 9 major labs that also offer our services across 16 locations. And just to name a few, A few of these labs include Oak Tree Medical Center, Doctors Hospital, Bonaventure, and Premier Medical Laboratory. Our digitally enabled care provides our beneficiaries with the opportunity to receive their health records in an electronic platform, which also enables the telehealth feature for applicable visits. This afternoon, it is a pleasure to introduce Ms. Tanisha Pinder. She is an administrative office manager with more than 25 years experience, with a specialty in office management and customer relations. She now functions in the capacity of Benefits and Enrollment Supervisor at the National Health Insurance Authority. Ms. Pinder's focus is to ensure the smooth operations of the NHI Enrollment Center and ensuring that all registered primary care providers deliver services in accordance with the NHI plan benefits. Ms. Pinder has a passion for cultivating a harmonious and efficient work environment, which allows her colleagues to graciously represent the organization. She is ecstatic about her role in NHI, which is helping to shape a healthcare framework for the Bahamas that is modern, affordable, and accessible. This afternoon, Ms. Pinder will be presenting on the topic, A Beneficiary's Guide to Selecting a Provider. Let's welcome her. And as Ms. Pinder delivers her presentation, should you have any questions, we will definitely answer those questions during our question and answer session during the presentation. And we're asking that you place your questions in the group chat feature if you're accessing the presentation via Zoom. And for those of you that are logged on via our Facebook Live account, feel free to drop your question right underneath the video on the platform, and we will make sure that those questions are adhered to as well as focused on during our question and answer session. And so without further ado, Ms. Pinder, the floor is yours.
So good afternoon, everyone. And thank you so much, Ms. Sawyer. Much appreciated. And thank you, everyone, for joining us this afternoon for our monthly beneficiary educational session. And yes, I will be sharing with you just some small tips on our beneficiary guide when selecting a provider. And this is from experience from our beneficiaries from calls that we get every day. So these are just some small tips that I'm going to share with you today. And as Ms. Sawyer said at the end of the presentation, please feel free to drop your questions in the inbox. So Ms. Sawyer. Thank you. So when selecting a primary care physician is a very important step in managing your healthcare. So your primary care provider, or PCP, as you would hear me refer to throughout my presentation, a PCP is the person you speak to about your health questions and concerns. So some patient primary care relationships can span decades, while others will be short-lived because you change your insurance or you may relocate. So no matter how long you plan to see your primary care physician, this relationship is very important. You want to select someone you feel comfortable with, having honest conversations with, and someone with expertise in the area that meets your healthcare needs. So what is a primary care physician? Next slide, please. So a primary care doctor is the person you can rely on to help manage a wide variety of healthcare needs, both routine and expected. A primary care physician addresses basic health needs. They answer health questions and provide long-term care as patients move through the stages of their lives. Your primary care doctor is your medical home. It's a doctor you will visit for most medical needs, including your general sick visits, your annual physicals, routine screenings, immunizations, and non-emergency illnesses, as well as preventative care, long-term care, and basic diagnosis and treatments. So your primary care provider also will provide you with referrals or to specialists if the need does arise. So here are 4 reasons why you should have a primary care provider. Reason number 1, your primary care provider knows you better than any other doctor. Number 2, they will care for you throughout your entire life. They can help you prevent diseases. They will keep you out of the hospital. That's the intent. So now I'm going to give you 5 guidelines when selecting these providers. Here are some guidelines, or here are some tips that you should look at. Next slide for me, please, Ms. Sawyer. So the first thing I need you to do is you're going to determine which doctors are in the network. So to find the doctors in the NHI network, you're going to log on to www.nhibahamas.gov.bs, and you're going to take a look at our providers listing. So you'll click on helpful documents and pull up the providers listing. And this will give you a list of all of the available doctors in the NHI network. So you want to start there by selecting one of the doctors in our network. Okay, so once you've done that, then you're going to find a doctor. You want to find a doctor with expertise that meets your healthcare need. So now that you have the list of the doctors in our network, you can begin narrowing it down. There are several different types of doctors that will be identified as a primary care physician. So you have your family medicine or family practice doctor, and your family practice physician can treat patients of all ages, from newborns to the elderly. They are generalists who can treat a wide variety of conditions and often can also treat ailments. You'll normally see like a specialist for like your sports injuries or even some women's health as well. Then we have our internal medicine doctors or internists. So the internal medical physician typically treats adults and focuses on conditions that affect the internal organs. They specialize in the prevention and diagnosis and management of diseases and all chronic conditions. You have your general practice doctor or general practitioners, and these physicians are like family medicine doctors as well, and they can also treat patients of any gender or age. We have our pediatricians. So the pediatricians are primary care physicians who treat children from infant to teenagers. So that's from age from 0 to 18 under the NHI Bahamas plan. And they provide treatment for physically, behavioral, and mental care in children as well. And lastly, you have your OBGYNs. These are your obstetricians and your gynecologists. So it's OBG stands for obstetrician or the obstetrician or obstetrics. And this is a doctor who cares for women and their babies during pregnancy and childbirth. And then you have your GYN, which stands for the gynecologist or gynecology. And this is a physician who specializes in treating female reproductive conditions. So these are the specialties that our doctors possess under the NHI plan. However, under the NHI Bahamas plan, we offer primary care services, and anything outside of that becomes an out-of-pocket cost to our beneficiary. So if a doctor has to go into their specialties, then this becomes an out-of-pocket cost. But all of our doctors practice under the NHI plan as primary care physicians. Next slide. So ask for referrals. This I love. I love to speak with friends and family members and co-workers. I want to know what their experience was like with a particular doctor. So whenever I'm looking for a particular doctor, I will speak with persons who may have already had the experience with that. So I think it's very important to get those suggestions from friends, family members, or co-workers. You can also ask another healthcare professional with whom you may have a relationship with or whom you know very well, that you've built a relationship with. You can ask them, so what do you think about this provider or that provider? And you can use that as a process of elimination. Also, if you are relocating, you're going to ask your current doctor if they have a recommendation for a new private doctor in that area that you're relocating to. So let's say if you're leaving New Providence and you're moving to one of the Family Islands where we do have NHI facilities, you can speak with your current primary care doctor and say, hey, I'm moving to Eleuthera. I know NHI has 3 facilities. What would you recommend? Which one of those facilities or which one of those doctors that you would recommend for me? So that's another good step in your process of elimination. Next slide. So let's look at logistics. Think about logistics, right? Do you want a doctor located close to your home or office? Search for the doctor with an office location that is convenient for you to visit. You always want to consider office hours. What days and times does the doctor see patients? Will I need to take time off from work to visit the doctor's office? Or can you just go after work or even on a weekend? So these are some very important questions to ask yourself. Also, you might consider language is another important factor to check. You need to be able to communicate clearly with your doctor. So check which language he or she speaks to be sure you're able to understand each other. Also, many doctors now use emails and or online portals to communicate with their patients, which may be another item of importance, but it depends on what your healthcare needs are. So visit the doctor's office. This is another extremely important. This is why I saved this for last, because I think this is important, right? Secret shopper. So you want to shop around. So you want to visit your doctor's office maybe when you take a look at our network and your friends recommend this particular doctor's office. Maybe you want to do a pre-visit to that doctor's office, right? Nothing can really give you a feel for whether you're selecting the right doctor, like an office visit or a face-to-face meeting. So when in the doctor's office, you should evaluate other factors. So consider the demeanor of the people who answer the phone and greet you when you walked in. Did that make you feel comfortable? Are they efficient and friendly? Even, are their phones being answered in a timely manner? When you're sitting in the doctor's office and you hear those phones ringing off the hook, how does that make you feel? If you're the person on the other end, right? And how long was the wait time to see the doctor after you arrived for the appointment? How much face time did you get with your physician? Was the opportunity to explain your health concerns sufficient? Did the provider listen and address those concerns? Did you understand the information that was given? Did the doctor, was the instructions that the doctor gave you on how to take your medication? Did you clearly understand it? Was it clearly explained to you? So these are just some of the things that you want to ask yourself when selecting, when you visit the doctor. Were you comfortable with all of this when you ask yourself these questions? Be sure to feel comfortable in the doctor's office and with the physician, the nurses, and the office staff. And of course, if at any reason you're not happy with your choice, under the NHI Bahamas plan, you are allowed to change your primary care provider at any time for any reason. Next slide. So in closing, and just before I close, I want to encourage everyone to build relationships. So when selecting your doctor, you want to always make sure that it's so important to be comfortable, because if you're comfortable, I feel you would definitely share more information with your doctor. Your doctor should be someone that you don't hold any information back from. In order for them to treat your medical needs, they're gonna need to know everything, right? And in order for you to feel comfortable and to trust them, you're gonna need to build a relationship with your primary care provider. And so we encourage our beneficiaries to always try to build that relationship with your doctor. Get to know your doctor. Whether you're in there for 20 minutes, 30 minutes, 45 minutes, ask questions. Build a relationship with your doctor. In some cases, you'll be able to call your doctor after hours on the telephone and ask a quick question. You know, hey, doc, I'm experiencing this. What do you think? But this is all going to be in building that relationship after a period of time. But if you're not comfortable, then you definitely won't even go and see the doctor. In most cases, some persons don't even see the doctor because they're not comfortable with that, their primary care provider. We don't want that in the program. We want persons, we give you the option because we want you to be comfortable. We want you to build relationships with your primary care provider. Your primary care provider is their key focus is preventative care. And that is the key to the NHI Bahamas plan. The program was created for preventative care because we want to make sure that we're creating a healthier nation here in our country. And in order to do that, we want to give persons, everybody, access to primary care services. And so we have a network of over 149 primary care physicians, and that's spread across 79 private facilities. So you can select any one of them. We are also constantly looking to expand in the Family Islands as well. And we're also looking to onboard additional providers as we continue to grow this plan. But your primary care provider mission is to help you stay healthy. They're there for you, whether it's for an occasional illness or support and guidance in managing any chronic conditions. So I encourage you to continue to build those relationships with your primary care doctor. So in closing, like I said, your primary care physician should be someone you trust and can rely on to help manage your healthcare needs. Talk with him or her about your current medication you are taking and your medical history to be sure that you are all on the same page when it comes to managing any chronic illnesses or just your overall general health care. Finding a primary care physician is a choice many patients will have to face at some point in their life. This doctor will be your trusted healthcare advisor and likely treat you for many, many years to come. So take the process slow because you want to make sure, like I said, you are comfortable with your primary care provider, because these relationships can last for decades if you find the right primary care provider. So if you feel it is necessary, use my tips, ask a friend, ask your other physicians. Like I say, go to the office, visit that office and see if that's an environment that you're comfortable in, you know, but look for a doctor that you can trust and who will become a compassionate advocate for you and your family's health. So I thank you all for listening. Those are my quick tips for you when selecting a primary care provider. I'll turn it over to Ms. Sawyer and we'll open the floor for questions.
Good afternoon again. Ms. Pinder, that was such a wealth of information. It was very concise, to the point, and definitely helpful. We had a few questions that have been sent in to us, and I wanted to share those questions with you so that we can get further insight and direction. The first question that we would have received, it says, how many visits are included per year?
So excellent question. Thank you for that, Ms. Wyatt. So you have unlimited general sick visits with your primary care provider under the NHI Bahamas plan. You are also entitled to an annual physical, but you have unlimited general sick visits under the plan.
And the second question is, can I be assigned to more than one provider?
So under the plan, you're only allowed to select one primary care provider to access your services. So you can only select one of the providers from our network. Once you've made that selection, then you have access to unlimited visits with that primary care provider.
Okay, so if I have access to one provider, then how often can I change my provider?
So you're permitted actually to change your primary care provider at any time for any reason. The process is very simple. You can just contact us at 396-8500. Any one of our benefit specialists will facilitate the reassignment for you, but the process is very simple and you are allowed to change your doctor at any time. The goal here is to ensure that you are comfortable with your provider, as I said in my presentation. So at any time you're not comfortable with your provider, please feel free to give us a call. We'll have a conversation and we can make the change for you.
Yes, I would definitely encourage those of you that are listening, particularly our beneficiaries and those who may have been told or informed about the NHI Bahamas program and you're considering enrolling in the program. The benefit specialist team here at NHI is very, very helpful. They're very thorough. They ask you the right questions to guide and lead you in selecting your provider within our network. And so you definitely would get all of your questions answered, and you definitely be led and steered in the right direction, which is our aim here at the authority, to make sure that we provide the customer service, that quality healthcare and customer service for our beneficiaries.
And that's because we're so passionate, Ms. Sawyer. That's because we're very passionate here at the authority when it comes to healthcare for our beneficiaries and for the Bahamian population at large. You know, like I said earlier, the plan was created because we want to ensure that we create a healthier Bahamas. And this also includes our children, right, who are the future. So we also want to encourage parents to have their children do their annual physicals as well, so that we can grow some happy, healthy adults. So
yes,
here at the authority, yes, we are very passionate about creating a healthy Bahamas here. And so we encourage everybody, you know, to be comfortable with their providers. And like I say, you can always call us and make those changes.
Can you provide us again, Ms. Pinder, with the contacts to call and change the provider?
So yes, our general phone line is 396-8500, or they can reach out to us via email, connect with us via email at info@nhibahamas.gov.bs, or visit us at our office here on East Street and Purpose Way, where we're open from Monday to Friday from 9 a.m. to 5 p.m.
Thank you very much for that. So let's talk a little bit, Ms. Pinder, about the providers within the family islands. I know you mentioned the scenario about relocating to an island and getting that referral from your healthcare professional or your primary care physician as to who you should now seek alternative medical care with. But what if I were to relocate to an island where there's no NHI provider? What would be your recommendation to me as a benefits and enrollment supervisor and specialist?
So that's an excellent question, and thank you for that, Ms. Sawyer. And so, as you would have spoken to earlier about our digitally enabled care that we launched in 2019. So a lot of that's a feature called telehealth. And telehealth is just simply bridging the gap to connect beneficiaries with their provider. So you're using Wi-Fi connection to connect our beneficiaries with their provider. So a lot of our doctors now offer telehealth to their beneficiaries. Also suggest the persons, if you frequently travel, and most persons do, from the family islands to New Providence to seek healthcare, then you can assign yourself to a doctor here in New Providence or Grand Bahama or whichever island that you're most comfortable with. We have facilities on 7 islands here in the Bahamas. You have Abaco, Eleuthera, Grand Bahama, Cat Island, Bimini, and New Providence. So you can select a provider on any one of those islands, but those doctors also offer a feature called telehealth or telemedicine that they can connect with you via your Wi-Fi, via Wi-Fi connections using the telehealth feature.
Yeah, so that telehealth feature is so important, especially we've discovered being in a COVID-19 environment. That feature was very, very accessible and helpful for our beneficiaries during the lockdown periods. And so interruption of healthcare services did not take into effect amongst our beneficiaries.
Yes.
Is there a plan to increase the providers within our network, as most of our providers are already at a full patient capacity? Can you speak to that, Ms. Pinder?
So yes, we're constantly looking to expand our providers network. We actually have several doctors currently in the pipeline for onboarding. We're looking at another 2 doctors in Grand Bahama as well, and 2 of our family islands. So we're constantly looking to expand the program, but the program works by choice. So for our beneficiaries, you have a choice to choose which provider you would like to have, as well as our providers get to choose if they'd like to be a part of the NHI Bahamas plan. But we are constantly looking to onboard new providers.
That's good information for us to know. So here is a question that's coming into our chat. If I am referred to a specialist by the NHI doctor, is there subsequent communication between my NHI provider and the specialist concerning my condition so that they would be on the same page as far as any treatment is concerned?
Yes, and that's an excellent question. So my answer is yes. So your PCP or primary care provider will send you to a specialist, right? So that's a referral. So they will refer you to a specialist, let's say an oncologist maybe. You now as the beneficiary, because for beneficiary privacy, you can determine if you want to have your notes, all of your medical history sent over to the specialist. And so you're going to communicate, and this comes again into building that relationship and being comfortable having this conversation with your primary care provider. And so you're going to ask them to share that information. So they're going to send you, a referral goes over to the oncologist. That means all of the current blood work or any history that you may have currently on file will be sent over to the oncologist. But you can speak with your primary care provider concerning that, to have the information forwarded so that they can see your medical history and determine what's the best course of treatment for you.
So, Ms. Pinder, I guess also as well as a beneficiary, what about accessing my electronic health records? Once I have access to my electronic health records as a beneficiary, do I also have the ability to share that information with the specialists?
So yes, as a part of the EHR system, beneficiaries, we have a beneficiary portal, and you're going to access that through your provider's office. So you can request that through the provider's office. They will send you a link and you can set up your beneficiary portal. And in that portal, you're actually able to see all of your medical history. You can access your medication, any prescriptions that you may have. You can also request to have your lab results sent to the portal, as well as we offer a lot of educational advice, health educational advice materials on the portal as well.
Okay, this is very good for us to know. We have a question from someone in Exuma. I'm in Exuma and there are no specialty service providers. A lot of services require an X-ray scan, podiatrist, etc. How can telemedicine help with this? You always have to travel for these services. And so I'm guessing that this question speaks to specialty coverage. So can we speak again to the type of service coverage that our beneficiaries are afforded under the NHI Bahamas program? Ms. Pinder?
So yes, and that's another good question, Ms. Soya. So as far as diagnostic imaging, under the PCTI, which is a primary care initiative that we've launched, we're always hoping to add additional benefits as we continue to expand the program. And so we're looking to add diagnostic imaging, hopefully before the fourth quarter of this year. but within the Family Islands, and you're talking about Exoma in particular, I know we have one facility there now. I know that the doctor there, Dr. Roll, is looking to expand her facility and maybe be able to offer diagnostic imaging at some point. But because that service is not available in Exoma, then definitely this patient would have to travel to New Providence in order to access that service. And so we're looking at all of those things. But in the Family Islands, we're hoping to have our facilities equipped to where they are able to accommodate our beneficiaries on the Family Island when it comes to lab work and diagnostic imaging.
Thank you for that, Ms. Pinder. I think this may have been the last question that we would have received. And so we want to continue to encourage you while we're in this period of question and answer. Should you have any questions, feel free to drop it in the chat. I know some persons just joined the Zoom meeting room. And so if you would have missed any of the presentation, we will share the recording on our Facebook channel as well as our YouTube channel. And so you're always welcome to go back, rewatch it, like it, and also share the recording with friends, family members, so that they too can be informed about the discussion. Are vaccines for college students covered by NHI?
So it depends, Chandra, what type of vaccine they would need. All immunizations and vaccines are covered for all school-age children, and that would be from 0 to 18, right? For our pediatric students. But we also have some vaccines that are covered under the plan for adults, but it would be the doctor, their NHI doctor or their primary care provider would determine, they will let them know which ones are covered under the plan, because I'm not sure all of the vaccines that are required for a college student. But it would have to be, your primary care provider will discuss that with you and let you know which ones are covered and which aren't covered.
Thank you, Ms. Pinder. And this may be the final question, but are prescription covered under the NHI Bahamas plan?
So we do not cover medication at this time, but we do encourage our beneficiaries to apply through the National Drug Plan for prescription medications, right? And you can do that through social services or at NIB's office. And you can also speak with your primary care provider as well on how to access the prescription drug plan.
So those options are available to us as Bahamians and as legal residents. Primary care coverage through the NHI Bahamas program and the National Prescription Drug Plan through the National Insurance Board. Mm-hmm. I think that's it for the questions, Ms. Pinder. I don't see any other questions in the chat. And so thank you again, Ms. Pinder, for taking the time to engage us on the information and guiding us on a beneficiary's guide to selecting a provider. This information, I'm sure, has been helpful to so many individuals on the call. I'm sure it was timely. And so if there is an opportunity for further education, feel free to reach out to us via our social media channels. You can call us at the office, as well as you can send us an email. And so before we end the call this afternoon, we just wanted to inform those on the call, what are you looking out for as it relates to health and wellness? We have some opportunities that are afforded to our beneficiaries and the public to, one, help them and aid you in changing your lifestyle and helping you on your journey. And so three important events that we have coming up. One is our Power Hour, which is held every third Thursday. For 1 hour, we meet and we gather and we're led by an energy and power-packed session by a certified fitness instructor. And this is an opportunity for the entire family to come out and work out together. Each month, you're welcome to join the NHI Bahamas program as we host a virtual and or a face-to-face educational session similar to the one that you're on or listening to now. And these sessions are available to our beneficiaries and the public at large. And we use these sessions to educate and inform on a health and wellness observance or an aspect of our NHI Bahamas program. Our virtual wellness challenges, they were launched this year and they're held on a quarterly basis. And for the month of March, which is known as National Nutrition Month, we've been hosting a Eat Green with NHI challenge. And so if you check our social media pages, Facebook, Instagram, as well as Twitter and LinkedIn, you would have found some guides and some tips on how you can eat green. And it's an opportunity for you to win a prize by participating in the challenge for this quarter. Tonight, you are encouraged to join us as this is the third Thursday of the month, and you're welcome to join us at the C.W. Sawyer Primary School from 6 p.m. to 7 p.m., where Craig Walken from Outdoor Fitness will be leading our power-packed energy session. And we're encouraging you to bring your exercise mat or towels. And we'll also be hosting our first power raffle for the year. And so if you attended all of the power hour sessions for quarter 1, 2023, you will be eligible to enter the raffle. And we have some exciting prizes to raffle off this evening. On Monday, March 27th, we're also inviting you to join us here at the National Health Insurance Authority in our courtyard as we host the March edition of our Farmers Market from 12 to 3 p.m. We are encouraging you to eat healthy, to eat fresh, locally grown, seasonal products, fruits, vegetables, as well as honey and more. And so we have an array and an assortment of vendors, local vendors that will be participating in our farmers market. And as you spend, you have an opportunity to also win some prizes. So every 30 minutes, we will be raffling off some free giveaways, which are sponsored by our featured vendors. And so take your lunch break, join us here at the National Health Insurance Authority on Monday, March 27th. All of this information is sent to our beneficiaries via their email addresses, as well as it's loaded on our social media platforms. We want to thank you again for taking time out of your busy schedule to log on with us. I hope that many of you would have been enjoying your lunch break or your lunch at your desk. And so I'm leaving our contact information here with you. Feel free to screenshot it and reach out to us. And we look forward for another opportunity where we can educate, enlighten, and inform you, our audience, our beneficiaries. Stay tuned for our April beneficiary educational session, as well as the subject of choice. And we look forward to hearing from you again. Have a great day, everyone. And thank you so much again, Ms. Pinder.
Thank you, everyone. Have a great day.